Diabetes is a dangerous chronic category of disease that occurs when high sugar level in the body. Indonesia is the country with the fifth highest diabetes population in the world. There are people with diabetes reaching 19.5 million with a prevalence of 10%. One of the most feared chronic complications of diabetes mellitus is diabetic foot ulcer, which is the complication that can lead to severe infection, gangrene, and amputation. Statistics show that the amputation procedure in 6 out of 7 diabetic foot sufferers begin with a superficial wound, even though 85% of these injuries can actually be prevented and handled properly. Indonesia is an archipelagic country. Unfortunately, in rural areas of Indonesia, there may be a lack of specialist wound care service. Transportation and communication barriers can also make it difficult for patients to access healthcare service, make it challenging for individuals with diabetic foot ulcer to receive timely. On these issues, the Indonesia Ministry of Health has implemented program to train healthcare professionals in diagnosing and managing diabetic foot ulcer, providing equipment and supplies to support wound care service in rural areas. This initiative aims to improve access to healthcare service and reduce the burden of diabetic foot ulcer on individuals and community in rural areas of Indonesia. To prevent amputation and improve quality of life for people with diabetic foot complication in Indonesia, Wocare present to promote awareness of diabetic foot complication through education, advocacy, and community outreach. Wocare Indonesia is an organization that stands for wound care and amputation prevention. Wocare Indonesia has collaborated with other organizations and institutions to develop guidelines and standards of care for preventing and manage diabetic foot ulcer. The organization also provides support and research for patients with diabetic foot ulcer and their family, including information on proper foot care, wound management, and the importance of glycemic control. In addition, Wocare Center has the KISS program called Komunitas Kaki Sehat se-Indonesia, which is a community service program in the form of foot health education, foot screening, and foot treatment, one of which is the diabetic foot spa. In this program, Wocare Center has contributed to educated of 22,000 certified wound care clinicians and promote them to open the service such as private nursing practice or home visit with foot care and wound care service. Amid worries, Wocare gave hope and reached out to help people with diabetes. We emphasize the importance of patient education and self-management, which can empower individuals with diabetes to take an active role in their foot care and reduce the risk of complication and stop amputation.